Hello and welcome to the channel. I'm glad you're here. Today I want to discuss magnetic therapy, and this is probably the most important video I've ever made. I want to state, first of all, that I am going to share with you my clinical experiences using magnetic therapy over the last 20 years. I want to share my protocols, the sort of results that I've seen personally. What I'm not going to do is make medical claims. So I'm not stating that magnets can heal or cure anything at all. Again, I am just going to share my clinical experience with you. Now, you as the viewer, as an intelligent, smart viewer, you can take these experiences that I'm going to share and you can decide to do whatever you would like to do with that information. That is completely up to you. But we have to have this agreement and understanding before I get into this information because it's controversial, right? And my purpose with this channel is simply to help people. I don't want to get involved in politics. That being said, let me tell you about my experiences with magnetic therapy. I mean, it's been nothing short of incredible. So first of all, when I'm talking about magnetic therapy, I'm not talking about some big machines that you have to buy. I'm not talking about even pulse electromagnetic field generators, which I've used in the past. I'm not talking about any of that. I'm talking about magnets, bar magnets. I'm talking about magnets that look like this magnet right here. This is a 39 gauze magnet. This is made by a company called Health Industries from Murray, Kentucky. They're no longer in business, but these were my original magnets that I used back in 2005 on patients. Comes in a plastic case. And if you remove the top of the case, you'll see that it's just a bar magnet, right? That's what's in there. Now, the magnets are marked for their polarity, South Pole, North Pole, and we're going to get into that in a minute. But that's it right there. And so these are the exact magnets that were given to me by my mentor, Dr. Robert Wooten. He is the doctor that taught me everything I know about magnets. He taught me more than that. I mean, he taught me just about everything I know about healing, about everything I know about patient relationships. He was my mentor. He's passed away since then. But one of the things that he did teach me, which was very useful, was how to use magnets to reduce suffering. And these are actually this is actually the magnets that Dr. Wooten gave me when I left and went off onto my own. This one's kind of old, and I used to have four of those. Now I only have three. Here's two more. We would also take them like this and stack them together to increase their strength. So let me tell you about how they worked. First of all, I remember when I first saw Dr. Wooten using these magnets, I thought, what is this all about? What kind of magic is this? He would put the magnets on patients and they would respond within 15 to 20 minutes, that quick. And I just thought that was the craziest thing I'd ever seen, right? Because I didn't really believe in it. And Dr. Wooten, he sensed that I was skeptical one day, and he said, "You don't believe in these magnets, do you?" And I said, "Well, I believe that these people are getting better." Right? Because I could see it on their faces. I could see that they were relieving the suffering. I could see that they were feeling better. But I said, I'm not sure that the magnets are what are doing it, you know? He said, no, it's the magnets. And he said, let me show you something. And he grabbed this exact magnet right here. And I know it's this magnet because I have it marked. And he handed it to me. And he said, take this magnet, take the north side of the magnet, and he said, rub it against the bottom of your lip. Just like this. And he said, what do you feel? And I said, well, I feel a tingling sensation. He said, yes, that's the magnetic field. He said, your body is composed of water mostly, and water is a polar molecule. So it is impossible for a magnetic field to not affect a polar molecule. He said, that's it. That's all you need to know. Magnetic fields definitely have an effect on human tissue. He said, what we're doing here is we are using that magnetic field to help people. I was still a bit skeptical, but he had my attention. He asked me to do an experiment. He asked me to get some mung beans and to put some mung beans in two different glasses with water. In this glass over here, he said, take a magnet, put the north side up, and lay the glass on top of that magnet. And on this side, take your glass of mung beans, put it on the magnet with the south field or the south side up, and let those beans sprout, which is what I did. A couple of days later, they started to sprout. The results, and you can reproduce any of these experiments yourself, the results were shocking. So the bean sprouts, the mung bean sprouts that sprouted with the north field, about a third of those beans did not sprout. The water was murky and slimy. It smelled off, and the beans tasted horrible. The bean sprouts tasted horrible. They weren't crunchy, they were soggy, they were mushy. Over here, the bean sprouts that sprouted in the south magnetic field. First of all the beans sprouted. Also, the bean sprouts, they were green, deep green in color. The water was crystal clear. There was no smell. They were crispy, crunchy, and tasty. Now, that to me was a miracle. I couldn't believe that. And from that day on, it got my attention, and I began to incorporate using magnets in a clinical setting. And again, saw great results. The basis of that experiment with the bean sprouts gives you the information that you need to make clinical decisions, or it did for me as a young doctor. What I determined was that a north field, so again, using the north side of a magnet, the north magnetic field was a field that would retard or slow down activity. And the south field would accelerate or speed up activity. That was the basis of my gestalt, right? To figure out how to use these in a clinical setting. So if I had a patient that came to me and they had a lot of pain, what do I want to do with the pain? Accelerate or decrease? Decrease. North side of the magnet over the area that's affected for anywhere from 12 to 20 minutes. That was my first protocol. And that would reduce pain. In most people, they would feel a difference in 20 minutes. And we were using these, this was the actual magnets I used, these 39 Gauss magnets. Sometimes we would double them up or use 2 magnets or 3 magnets or 4 magnets. But these were the magnets we actually used. These were the actual magnets that I used. Likewise, the north polarity would decrease inflammation, right? So that was usually my go-to field for most people. But then after a few days of using a north field, I would switch over and I would use the south pole to increase protein synthesis, to increase cellular division, to increase healing, right? And so that's how I used these magnets. Now, you definitely don't want to use a magnet if you have any electronic equipment implanted inside of a patient. For example, a pacemaker or a brain stimulator. You don't want to expose that to a magnetic field. It could really cause problems. But other than that, there really is no contraindications. Now, the company that I talked about, Health Industries from Murray, Kentucky, they're no longer in business. And I've tried very, very hard to find a replacement company, and I've never had any luck until about 2 weeks ago. And 2 weeks ago, I discovered a company, an American company called ProMagnet. And ProMagnet, they make this beautiful magnet right here. It's 2 pounds. It is 3,900 Gauss. So it's the same power on these original magnets that I have all the experience with. 3,900 Gauss. And what it is they have here, they mark the north side with an N, and they put it in this beautiful little case, which makes it very convenient, easy to use. And I use this myself in my own, personal healthcare regime. I take the north side, I put it on my lower back if my lower back is acting up, if I'm having any problems with those discs, I want to reduce inflammation or pain. Also, though, what I use it for is I'll use the south side and I'll use it over my gallbladder because I have a sluggish gallbladder, and if I want to speed up my bile production, I'll use it there. So you can use the magnet accordingly on different types of tissues in your body, depending on what sort of an effect you want to get. Now, my wife, what she likes to do is she likes to take this magnet with the north side facing up. She likes to take a bottle of spring water and lay it on top of the magnet like that for about 15 minutes or so and charge that water with the north polarity magnetic field. And it's her understanding that by drinking that water, she is essentially drinking an anti-inflammatory mixture. So that's a lot of fun, and that's something you can experiment with, something that everyone can experiment with and come to their own conclusions about. You know, one of the big frustrations for me, especially when I was originally in practice, I was a young doctor, I was very insecure. I thought that I didn't really know what I was doing, as all young doctors feel that way. And I just had a really strong desire to help people. That's all I really wanted to do. That's why I got into this profession in the beginning, right? And I was using magnets on my patients, and they were getting better. And they were going back to their primary care doctors, and they were telling them that they felt better. And their doctors were saying, well, how is it your knee is better? You know, because he had been treating that knee for years. They said, I went to saw Dr. Stokes and got me better. And he used these magnets. And the doctor said, magnets? And then I would get phone calls from these clinics. And at first, I thought they were calling me because they wanted to congratulate me and they wanted to learn more about how to use magnets. I thought they wanted to go and buy some magnets. You know what I mean? But that wasn't the case. They were calling me, telling me that I was a quack, telling me that they were going to report me to the Board of Medicine. Thankfully, I wasn't part of the Board of Medicine, but they didn't really understand that either. That's a whole other story. But it was really sad, and it was really damaging and hurtful to me because, again, I thought we were all on the same page, just trying to help people. And I thought it was really frustrating. I thought it was confusing that these doctors that were saying that I was a quack for using magnets, they were writing prescriptions every day for their patients to go and get MRIs. And in its essence, the MRI and this little bar magnet use the same mechanism, basically, right? They're using a magnetic field to affect change in the human body. So I just didn't understand why they couldn't bridge that gap. But then again, I've always stated that I was a clinician, not a scientist. I'm interested in things that can reduce suffering. And if something has clinical data behind it, then I'm a supporter. I'm a supporter first if the clinical results are there and the science later. Because sometimes the science has not caught up enough to be able to explain things that happen. But that doesn't mean that they don't happen, and that's really important. Something for you to consider as you try to digest this information that I'm giving. So I hope this was useful to you. If you have any questions, just reach out to me on my website. All the contact information is there. You can contact ProMagnet if you're interested in that. You can learn more about me. You can download free copies of my books. In particular, The Philosophical Physician. There's a whole section in there where I talk about my mentor, the late Robert Wooten. Rest in peace, Dr. Wooten. And I hope you enjoyed this video. Give it a thumbs up if you did. Subscribe. Stay healthy.